Hi everyone, I'm Dr. Tiffany Zugan and I'm a naturopathic doctor in the GTA. I currently practice in Etobicoke and Burlington, and I run a general practice, which means I see patients of all ages with all health concerns. But generally my practice focuses a lot on women's health, digestive health, pain management, and weight management. If you are looking for a naturopath and you're in any of those areas, feel free to reach out. Today we're going to talk about the quote-unquote perfect female menstrual cycle. As a woman who loves empowering women in my practice, I am all about being totally educated on what's going on with your body. And I find that a lot of women come into my office and they have some misconceptions about cycles, or they maybe think everything's going really well, but actually something's not quite right, or vice versa. They think that they're not normal, but everything is actually just as expected. So hopefully this video can clear up some of the fog surrounding the perfect, as we say, cycle. So when we look at female hormone cycling, there's really two main phases of our cycle. There's the first half of our monthly cycle, and that's really called our follicular phase. This is days 1 to 14 of your cycle. And what that means is the day that you start bleeding, we consider day 1. So it's the day you start bleeding to sort of mid-cycle, day 14. And again, that's called the follicular phase. And during that time is when estrogen is sort of rising and we are basically developing our egg cells. Okay, so we know that every month we release an egg, and that's how there is potential to get pregnant. In reality, there's a couple of eggs that kind of develop each month, and then one is picked as the primary egg, and that's the one that's released mid-month around that day 14. And that's called ovulation when that occurs. So that's the first half of your cycle. The second half of your cycle, from sort of days 14 to 28, is called the luteal phase. And that's the time where the body is really preparing for a pregnancy if that were to occur. So our progesterone tends to be higher during that time of the month. That's when we start to get some of those PMS-related symptoms. So some moodiness or some breast tenderness or headaches or cravings, all that sort of stuff kind of falls under that general side of PMS. And then at the end of that cycle is when you start bleeding, and that's kind of when we start our next follicular phase. So as I mentioned, the sort of general accepted perfect length cycle is 28 days. Generally anything to about 34 is considered fine and normal. Above 35 is what we call oligomenorrhea. So it means your periods aren't occurring as frequently as maybe they should. And there are lots of reasons for that to occur. The other option is for your cycle to be sort of much shorter than that 28 accepted day cycle. So for example, if you do have a shorter cycle, that could mean maybe your progesterone is a bit too low. If your cycle is longer, perhaps we're dealing with something like PCOS. Again, that's something for you to discuss with your own doctor, your own health professional, because there are lots of different reasons for these things to occur. But generally sort of the 27 to 34 days is a good, healthy, regular cycle. I also want to touch on the PMS side of things too. A lot of women do suffer from PMS in that second half of the cycle. And although that's really typical of what women experience, that doesn't mean that it's normal or healthy. Nobody should have to suffer with PMS symptoms throughout their period. So if you are having any sort of symptom, be it physical or emotional or mental, definitely seek treatment. There's lots that can be done to support women throughout their cycle to make sure that those kinds of things are either less frequent or not as severe, or they're not happening at all. So definitely seek help for that. And as I said, it's really important to be sort of mindful and knowledgeable about that sort of cycle that we're experiencing. So the other last thing I want to touch on is the fertility sort of piece, because a lot of women come into my office and they're at the point in their lives and they're trying to get pregnant and they're not timing things appropriately in their cycle to make themselves have the best chance for that. So perfect time in the cycle for you to get pregnant is around that ovulatory period. So again, that's sort of midway between the two phases we spoke about. It's around day 14. Now keep in mind, if your cycle is a little bit longer, maybe it's after day 14. If your cycle is a little bit shorter, it's likely before day 14. There are some ways for you to check if you're ovulating. They have what you call LH strips, and you can get them at any real pharmacy place. And it's just something that you urinate on, and it can tell you if you're having an LH spike, which essentially indicates that you're ovulating or you have ovulated. So if you're interested in more information on that, definitely reach out or do your own research. But again, around sort of that day 14 realm of the cycle is the best time for you to be getting pregnant, which is super important for a lot of women. So I hope this was a very helpful, educational, empowering video. And again, I am Dr. Tiffany Zugan, and I am a naturopath in the GTA, and I look forward to seeing any of you reach out or comment below. Have a wonderful day.